I'm not referring to weight fluctuations that occur throughout the day. It's normal to see a weight difference of several pounds if you weigh yourself first thing in the morning and again later in the evening. However, it's abnormal to see a weight change of 5 pounds from one morning to the next, as this suggests a serious issue, which coincidentally affects many patients with hypothyroidism. When this kind of rapid weight gain happens, it's easy to assume that it's related to fat. However, it is rarely the case, since it's extremely difficult to gain 5 pounds of fat in a 24-hour period. Rapid weight gain is almost always a problem related to fluid water shifts or changes in water weight in some way. This is because it would take a serious hormonal issue, which only happens in rare medical conditions, to cause rapid weight gain. However, this doesn't mean that the type of rapid weight gain you're experiencing isn't a problem or that it shouldn't be addressed. You just need to understand what causes it. Additionally, you must comprehend the distinction between the rapid weight gain we will discuss and the normal weight gain that results from low thyroid function. With that in mind, let's begin by asking whether hypothyroidism typically causes weight gain. Yes, it doesn't have to result in weight gain, but it almost always does. Most patients with hypothyroidism can anticipate gaining 5 to 15 pounds as a direct result of their thyroid condition. This weight gain happens because your thyroid regulates your metabolism. If thyroid hormone levels fall, your metabolism will also fall, and you will acquire weight as a result of this. Though it can be confusing, many thyroid patients end up gaining much more weight than just 5 to 15 pounds. While this additional weight gain on top of the 15 pounds is almost always related to your thyroid is not directly responsible for it. Instead, it tends to come from the issues we're going to discuss right now, which are what cause your weight to fluctuate rapidly from day to day. The weight gain you experience in this setting represents a true increase in fat mass and will usually occur evenly throughout your entire body. As previously stated, the first thing you should check if you are gaining weight quickly is your fluid levels. Here's how your body handles fluid. If you don't have a thyroid condition, the fluid that you get from your food and beverages enters your intestinal tract. Fluid levels are the amount of water that is stored in your body and in your tissues. Ironically, this water intake can vary quite a bit from day to day due to factors like your salt intake, hormone levels, bowel movements, and even your carbohydrate intake. There are several places where this process can go wrong, resulting in you accumulating extra fluid and gaining extra weight. When fluid accumulates in the tissues, we call it edema, and thyroid patients are particularly sensitive to edema because of a condition called mixed edema, where it is either absorbed by the body or kept in the intestinal tract to soften your stool. From your intestinal tract, it enters the bloodstream and travels to all of the tissues that need this fluid before reaching your kidneys, where any excess is removed in your urine. Glycosaminoglycans and hyaluronic acid can hold many times their weight in water, so wherever they go, water and fluid will follow. Full-blown mixed edema is actually a fairly uncommon condition for hypothyroid patients, but it's likely that many thyroid patients reading this right now have a much milder or less severe form of mixed edema, which causes a lot of extra weight gain. Because water is so heavy, even a small amount in your tissues can add a lot of extra weight to the scale. A big thank you to those of you who've stuck with us this far. Creating these videos takes significant effort and dedication. So if you're enjoying the content, please hit the like button, subscribe to our channel, and share your thoughts in the comments. Your support truly helps us grow. Now, let's get back to the video. Edema can happen anywhere in the body, but when your thyroid is to blame, it tends to build up in specific places, like the face, particularly around the eyes. This condition is called periorbital edema and affects roughly 22% of thyroid patients. In addition to periorbital edema, you've probably had this problem yourself if you've ever woken up with swelling around your eyes. Fortunately, this swelling usually goes down fairly quickly because gravity pulls it out of your face as you sit up, reintroducing it into circulation where it can be eliminated. Peripheral edema is another type of edema that affects about 55% of thyroid patients. This type of edema is localized to the legs and is more problematic than facial swelling for two reasons. First, because the legs have more tissue, which allows you to store more water. Second, because it's much easier to miss subtle swelling in the legs than in the face because you're constantly looking at your face, especially when you wake up in the morning. But how often do you actually check your legs? Most likely not, which is why peripheral edema frequently causes significantly greater weight gain. Compared to periorbital edema, this condition is the first thing you should check for. If you notice significant alterations on the scale, how can you get rid of this extra water through thyroid function optimization? Enhancing thyroid function is the best way to help your body move this fluid out of your tissues and eliminate it. But other strategies, such as exercise, massage, compression stockings, being active, taking certain supplements, and modifying your electrolyte intake can also be helpful. Thyroid issues may not always produce edema, so if you have it, you should have it checked out to be sure you're not overlooking anything serious. We need to talk about gut health, because edema isn't the only condition that can cause rapid weight gain. Next, we'll talk about constipation. If you notice that your weight is increasing by several pounds every day, the first thing you should do after checking for swelling is ask yourself when you've had a bowel movement. It may not be pretty, but your bowels can hold a lot of water in the form of stool. And stool volume can have a big impact on how much you weigh each day, especially if you're not regularly eliminating it. Constipation is one of the most common symptoms of hypothyroidism because when thyroid hormone levels are low, your digestive system slows down, which naturally results in fewer and fewer bowel movements. This issue can get so bad that some thyroid patients report only having one bowel movement every 4 to 7 days. Of course, if you have food in your stomach for 4 to 7 days, you'll not only notice changes on the scale, but also feel extremely bloated. The actual weight of stool varies depending on the consistency and amount of food consumed, but a single bowel movement can weigh anywhere from 1/4 pound to a pound. However, many patients with chronic constipation will tell you that they can easily gain 5 to 10 pounds in a week if they don't have a bowel movement, suggesting that weighing stool isn't an exact science. Constipation is never enjoyable, but it's not something you have to live with forever. Improving thyroid function and gut health, as well as modifying thyroid medication, can help alleviate chronic constipation and hypothyroidism. Your goal can be aided by increasing your intake of fiber from fruits and vegetables, drinking lots of water, and taking probiotics and prebiotics. Third, menstruation abnormalities or hormone-related weight gain should be addressed. As a thyroid patient, you should have at least one bowel movement every day. If you aren't, you should consider this a problem that needs to be addressed. This one only pertains to women. But since women are 6 to 8 times more likely than men to develop hypothyroidism, it's still crucial to discuss it. Women typically gain 3 to 5 pounds during their menstrual cycle, but this amount can increase significantly, particularly if there are estrogen and progesterone imbalances. The weight gain that women experience during their menstrual cycle is also linked to fluid movements. In fact, some women report gaining up to 15 pounds during the week of their period. This is how it operates. Progesterone and estrogen have conflicting functions in controlling fluid balance. When progesterone and estrogen levels are balanced, the system functions flawlessly and no excess fluid is retained. However, when progesterone and estrogen levels are out of balance, significant changes can be observed on the scale that may last long after the menstrual cycle is over. For example, it is estimated that 20% of women with hypothyroidism will have irregular menstrual cycles. This is primarily due to the thyroid hormone's influence on progesterone. In the hypothyroid state, progesterone levels tend to be lower, which allows estrogen to act uninhibited, increasing the amount of fluid-induced weight gain during the menstrual cycle. Hypothyroidism is a condition that is known to interfere not only with the menstrual cycle, but also with the hormones that govern the cycle. By observing how and when the swelling happens, you may quickly distinguish between menstrual-related edema and normal peripheral edema. This issue can be resolved by optimizing thyroid function, which will then act to balance your progesterone to estrogen ratio and prevent your body from retaining excess fluid during your menstrual cycle. If your weight gain is cyclical and tends to occur around your cycle, it is most likely related to the influence that thyroid hormone has on your sex hormones. In conclusion, rapid weight gain is a common and often frustrating symptom of hypothyroidism, and understanding the reasons behind it is essential for managing your condition effectively. As we discussed, when your thyroid is underactive, it leads to a slowed metabolism, fluid retention, and hormonal imbalances that can make it much harder to maintain a healthy weight. Recognizing these factors and addressing them through proper treatment, lifestyle changes, and a balanced diet can help you manage weight gain and improve your overall health. It's important to remember that while hypothyroidism can affect weight, it's only one part of a larger picture. Regular monitoring of your thyroid levels, a consistent treatment plan with your healthcare provider, and adopting a well-rounded approach to your health are key in managing your condition and feeling your best. If you're dealing with unexplained weight gain or suspect thyroid issues, don't hesitate to seek professional advice to get the support and resources you need for a healthier life. Remember, managing hypothyroidism is a journey, and you're not alone in this. If you found this video helpful, please give it a thumbs up, share it with others who might benefit, and subscribe to Health Angel Solutions for more expert insights on thyroid health and overall well-being. By subscribing, you'll stay up to date with the latest information, tips, and solutions to help you live a healthier, more balanced life. We're here to support you every step of the way.